But before we begin, I would just like to do an acknowledgement of country and acknowledge and pay respect to the traditional owners and elders of this country, recognizing their diversity and the significant importance of their cultural heritage, values, beliefs, and self-determination in contributing to the positive health and well-being of the whole community. Just a disclaimer, this webinar will be recorded. So for the purpose of that, the cameras and microphones have been switched off, but this webinar will be live and public once we are done this evening. Our speaker for tonight is Dr. Grace, who is part of the syphilis response team at Waterloo Public Health Unit. She brings education about the syphilis outbreak and other topical public health issues to primary care settings. So without further ado, Grace, I will pass over to you.
Thank you very much, Jamie. Tonight is very much aimed at some very simple overviews about sexual health assessment. A little bit of background about myself. I work in the Waterloo Public Health Unit, which is the public health unit for Perth. And we are a wide kind of multidisciplinary team looking at how we manage the public health aspect of communicable diseases. So you can see some of our roles and some of our teams in this little diagram. And those of you who might be listening from the regions will have your own regional public health unit, but anyone in the Perth metropolitan area is covered by us. Now, the reason that I work in the public health unit is because I'm on the syphilis response team. And of course, the reason we have a syphilis response team is because we've had a surge in syphilis. And, you know, I'm really here on this webinar to try to encourage you guys to screen for STIs more. We hope that if we can pick it up more and treat it more, we can try to get on top of the numbers. So here are some of the trends for STI infections in WA. Chlamydia is still the of our notifiable diseases. STIs is still our most common. You can see that there has been a sharp increase recently. Gonorrhea, lower numbers, so you can see the different scale there to chlamydia, but again, increases in recent years. And now a graph for syphilis. Now this is on a different scale as well as a different time scale. So the numbers are lower, but what we have really seen is a sharp increase in the last decade or so. Prior to that, syphilis was really uncommon. And, you know, part of my role in delivering education is to try to bring back to the forefront of consciousness that syphilis needs to be considered as a differential diagnosis again. It's not a disease of the past. It's something we need to be actively excluding now, including in our STI screens. So I did a lit search when it comes to sexual health assessments in general practice. And these were small studies, but I thought that the findings were very interesting. So this was a small study done in Victoria, looking at attitudes to, sort of receiving questioning about sexual health in general practice. And there was some hesitancy on the part of GPs to bring up sexual health if that was not related to what the person was coming in with, especially if that was the first time that they were meeting somebody. Another study looking at some of the barriers to discussing and testing for STIs in general practice found that actually most patients would not feel embarrassed. So even though GPs might have that sense, perhaps that's actually not reciprocated on the other side. There was a research done on young women's views of STI screening, specifically more chlamydia screening. And this found that the young women's views were that they felt age-based screening was very acceptable and not discriminatory. You know, it didn't feel like you were singling them out because you thought they were particularly promiscuous or whatnot, and that it was quite beneficial if the doctor could frame it in a public health kind of way. So, you know, talking about things like, oh, we've been seeing STI rates rise recently, so we're just offering more testing to everybody, you know, rather than kind of targeting, well, I think you look like you might need STI screening. You know, there has been some training in the past that kind of encourages people to ask patients about, you know, how many partners they've had, But these young women felt that, they wouldn't actually want to be truthful if they felt a little bit embarrassed, and that if you just kind of offered screening and framed it as a public health issue, that would be a lot more acceptable to them. Research on young men's views suggested that they also felt it was acceptable for GPs to raise the topic, even if they had come in for an unrelated complaint. There was some of the younger men who stated that they might feel more comfortable with having that conversation with a younger GP. The surveys found that there was a bit of a lack of understanding and information, such as the fact that STIs can be asymptomatic. And the young men, quite across the board, said that they were unlikely to initiate the topic themselves. So that's, again, really important for GPs to think about, that they would be happy for the GP to raise it, but they're not likely to raise it themselves. The periodic SASH survey that looks at high schoolers' views, the most recent one found that for young people, they did think that GPs were the most trusted source of information about sexual health. They agreed that STI testing is important, but again, there was that low confidence in bringing it up. So knowing that sometimes GPs might feel a little bit hesitant, but perhaps our patients actually are quite accepting of us bringing it up, and maybe could benefit from some information. Who are we offering screening to? We are offering screening to anyone who has a new sexual contact, anyone under 40, and someone did point out to me that obviously this is for anyone who's sexually active under 40. And we want to offer screening more frequently to people from certain risk groups. So men who have sex with men, people who use meth or inject drugs, people experiencing homelessness or unstable accommodation, and people who have transactional sex. So how can we bring it up, especially if they've come in for an unrelated complaint, and perhaps that we have some time, or you can see that they don't come very often and there's good opportunity to bring up their sexual health. So, think about a hook, a line that you can kind of just roll out to most people. I've made some suggestions here. They're obviously in my kind of wording, but you can think about how it might work coming out of your mouth. Since you're here, can I ask you a few questions as part of a general health check? And I think a lot of us would do that in terms of blood pressure. Are you due to get your cholesterol checked? The same with sexual health. Since you're here, can I ask you a few more questions about this? Another sort of option, we offer regular STI testing to young people because STIs are common, treatment is effective. Is this something that you are interested in finding out more about? Or we talked about the public health framing. We're seeing increases in chlamydia, gonorrhea, syphilis. So we're offering more testing. Is this something you'd like to find out more information about? They'll respond in a way that lets you know whether or not they're sort of open to receiving more information. And that's when you can sort of offer another little kind of bit of information to draw them in. Most sexually transmitted infections have no symptoms, so you can't even tell if you have one. But if you do have one, treatment is straightforward and, stops you from passing it on. And often I don't even need to examine you in order to do the test. And then if they seem open to that, sort of letting them know, okay, now I'm going to ask you a couple of personal questions. These are questions that I ask everybody so that I know what tests we need to do, and this is all purely confidential. Everything you say to me is kept private. And this is when you might want to find out more about their sexual behavior so you know which sites you're screening. So do you have sex with men, women, or both? Again, not making assumptions about the number or the gender of their partners. You can also get STIs in your throat from oral sex and in your bottom from anal sex. Do you think we should test those areas too? So again, less confronting than asking people, but kind of putting that to them. This is something that can happen. Should we also swab your throat and your bottom? And so that brings us now then to what tests you will actually order. For just standard screening where they have no symptoms and you're just offering screening. At a minimum, it would be a urine for chlamydia and gonorrhea PCR. For women, a self-obtained lower vaginal swab for chlamydia and gonorrhea PCR. If there is any anal sex, whether it's man or a woman, then we would ask for an anal swab. And same thing, throat swab, man or a woman for chlamydia gonorrhea PCR. In addition to the urine and the swabs, we are also asking for serology for syphilis and HIV. And I know that that's another step. They need to then go and get blood done. But again, if you sort of explain, we are seeing some increases in syphilis at the moment, and this is one way of being able to just exclude it. Hopefully that helps them to follow through. Obviously, if they have symptoms, then that's going to change your approach, and then you would be a little bit more focused on whether or not you need to swab the discharge, whether or not you need to swab the lesion or the ulcer, or whatnot, whether there are other non-STI differentials that you may need to consider. So obviously you would work them up a little bit more, but still at a minimum, you'd be wanting that urine, that serology, and then whatever extra investigations you're going to order. So this is just the kind of starter to hopefully put that thought into your mind. Who can I be offering STI screening to, or give you that confidence to offer STI screening more frequently? We're going to have more 15-minute bite-sized webinars coming up to kind of take this theme further. So we're going to be looking at interpreting test results, specifically syphilis serology, in more detail, and initiating management. And that's going to be presented by Dr. Lewis Marshall, who's a sexual health physician and public health physician at our Boorloo Public Health Unit. We are also going to be looking beyond that at initiating contact tracing and management of STI co-infections, and that's going to be presented by public health physician at Boorloo Public Health Unit, Dr. Suzanne McAvoy. And you guys would be aware, there has been a lot of development in the Hep C space. Treatment is available. Really, we are in a position where we're able to eliminate Hep C. So giving you guys some confidence to interpret serology and initiate the next steps for Hep C management, and that will be presented by public health physician Dr. Erica Parker. Okay, some resources there if you guys need more information, both on testing and treatment as well as sexual health assessment are available, as you can see on your slides. And then I will hand it back to Jamie.
Perfect. Thank you, Grace. I just want to finish up this evening by just plugging the feedback survey at the end. So if you found that this webinar was valuable and you were able to draw a lot of information for your practice, I would encourage you to scan the QR code and fill out the feedback form, just so we can get some responses based on that. And as Dr. Grace mentioned, we will be having another syphilis webinar on the 24th of July. So please keep your eye out on our website and all of our communications for that. And there will be a registration code available for you to sign up for that also. On behalf of myself and Dr. Grace, we wish you a pleasant evening. See ya.
Thank you.